Everybody is thinking and talking about COVID-19, vaccines, the virus, and what to do about it. And I want to spend a few minutes talking about the myths associated with the COVID-19 vaccination program and a little bit about the reality of where we are today. Basically, one of the common concerns is that there's really not enough science behind making the decision to give myself the vaccine or my children the vaccine or other family members. And I don't think this is really based on any logic because, in fact, data and evidence about the safety of vaccinations has been around for a long time. In fact, polio, which was really the first disease treated effectively globally, the polio vaccine has been around for almost 100 years. When they developed the polio vaccine initially, they used about 1.8 million vaccinations before they released it to the general public across the world to prove that it was safe. If you look at where we are today with COVID-19, over 350 million doses of the COVID-19 vaccine have been given in the United States alone, and globally it's much more than that. So there is plenty of data to support the safety of this vaccination. Additionally, many people think, well, it's not so bad. I'm a healthy person. It's not going to affect me. But the truth of the matter is, you really don't know and you can't assess how you're going to react if you get infected with the COVID-19 virus. We'll talk in a few minutes about the new strains of the virus, the variants, the Delta and Delta Plus variants, and why those are more effective in making you sicker. Additionally, everybody seems to know someone who had COVID and got better in a very short period of time. It wasn't that bad. But again, it's very hard to predict who's going to get sick, when are they going to get sick, and how sick are they going to become if they get infected with this virus. I've had people ask about the concerns that they have about the potential impact on fertility or being able to effectively carry a pregnancy. In fact, there has been no evidence or data to support the impact of COVID-19 on female or male fertility. And in addition, that you would have any kind of difficulty from obtaining the virus when you carry a baby, either your own or in a gestational carrier's surrogacy. The other thing is vaccine reactions. Some people are really worried that they're going to have a reaction to the vaccine. But in fact, because particularly now there are some very, very strong strains of variants of COVID-19, the reaction can be very mild compared to the effects the virus may have on you in the long term. And in fact, there's more and more data to suggest that there can be long-term consequences of you getting sick from the COVID-19 virus. So to dispel many of these myths, I think you have to understand that in spite of all the vaccinations done in the United States, there's a growing number of variants or variations from the initial virus, which have become even more effective in attaching to people's lungs and getting them infected. And in particular, it is now exposed and more common in children. And this is yet another reason to consider vaccinating. Not only are you protecting yourself, but you're protecting those around you, your loved ones, your family members, and most importantly, your children. So try to keep these facts in mind when you make your decision and understand that that in the long run, we're here not only to protect ourselves, but protect all of us as a society from this pandemic. Thank you.